I am happy to welcome everybody to our next conversation in our Healing Healthcare series. Today we have a fantastic guest, and this is a wonderful resource for anyone out there, again, in healthcare. If you're a nurse, if you're a doctor, if you work in a hospital in any capacity, or are interested in being in the healthcare field, I encourage you to watch our video and to, after you've watched it, to share it with anyone you know, anyone you love, anyone in healthcare. We are here to be a resource for everyone in healthcare and everyone who aspires to be in the healthcare space. So, Sheena, take it away.
Well, hi, everybody. We're so blessed to be with you today. And we are so blessed to have Dr. Iman. Dr. Iman has her MBA in the Wharton School of Business, and she has this amazing company. She's the CEO and founder of Incredible Health, which is this amazing company that matches qualified permanent nurses with hospitals. They have this amazingly fast technology that somehow matches these nurses with these hospitals in less than 20 days. They can start in less than 20 days. So I want to hear all about it. Tell us about Incredible Health. Tell us how you came upon it. Tell us everything.
Yeah, thank you so much for having me on the platform. First is that Incredible Health is the fastest growing career platform for healthcare workers in the US today. And as you said, hospitals and health systems, they use our software, our custom matching technology, our screening technology to hire nurses in permanent roles in 20 days or less. There's three key ways we do this. The first is that the employers apply to the nurses instead of the other way around. As you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax, they get interviews from different hospitals, and they get to choose. The nurse gets to choose which interviews to accept or decline. The second is we built a lot of pre-screening and pre-vetting technology. So our software automatically screens these nurse profiles. And then we have very detailed custom matching algorithms that makes sure that they are connected to the right employment opportunities. So for example, let's say you're a hospital recruiter at Baylor Scott and White or at Cedars-Sinai, and you log in, like you don't want to see 200 nurses, you want to see 10 that are the exact right fit for you at the time. And the same thing for the nurse. If you're a highly sought after ICU nurse, OR nurse, ER nurse, you don't want to hear from 100 employers. You want to hear from 5 that are the exact right fit for you. And so the end result of all of that is exactly what you described, Sheena. Hires happen in 20 days or less. The industry average is 90 days, and we can talk about why it is 90 days. And ultimately, we are also saving hospitals and health systems a dramatic amount of money. So at least $2 million per hospital, per facility per year in travel nurse costs and overtime costs. And it also helps reduce burnout too.
And just as you said, why is it 90 days?
Yeah, so we are, in the middle of a huge labor shortage. Healthcare is the biggest labor sector in the US by number of workers. 1 in 8 Americans works in healthcare. But our demand for healthcare as a country keeps going up, right? Our population is aging. Obviously, pandemics don't help, right? But there's just simply not enough workers in the system. And we're expected by 2024, we're going to be 1 million nurses short. It is the biggest labor shortage we have in this country today.
That just being a little bit. Hold on. I hear you, and I hear you on a different level too, because I'm seeing all the burnout that
Real time.
every day, right? So go ahead. I'm sorry. Continue.
Yeah, you're absolutely right. Sheena, you experience this firsthand at work, right? And unfortunately, the way hospitals and health systems hire really hasn't changed since like the late 90s. They post a job and hope something happens. What we often hear from nurses, Sheena, you may have heard this from your peers, is, hey, I apply to 10, 15 places and I usually never hear back. And if I hear back, it takes 2 or 3 months. So we just figured, like, this is crazy. Like, there has to be a better way. And that's how we came up with this whole concept.
And I have so many questions.
Mhm.
When you started this company, was it nurse? I know it's nurse based, but is there someone special to you that's a nurse that made you think of this? Like, how did you get to this point?
Yeah, so I'm an MD by background.
Okay.
I don't practice at all, but I am a healthcare worker originally, and I've been in healthcare technology for the last 10 years of my career. And really, a lot of my family members and friends are doctors and surgeons, and they were often complaining about understaffing them as well. Their units are always understaffed, the OR is understaffed. At the same time, my co-founder and chief technology officer, Rowan Portlock, he's one of these MIT whizzes, software engineer. He comes from a family of nurses, and his siblings and his family members were saying, "Hey, I'm experienced and I'm qualified, but it still takes me 2 or 3 months to get my next job. I apply to 10 places, I apply to 20 places, and I usually don't even hear back." And so that's how we figured there just has to be a better way, and that's why we co-founded this company.
It's beautiful because Philadelphia, where I am, whoop, whoop, Philly has is one of the biggest hospital cities in the country. But even here, you can apply to every hospital here, and it still may take you a couple months to hear back. And all of the hospitals are having shortages right now, and it's taking them months to pick up the extra staff. And in the meantime, it just makes the rest of the nurses want to quit too. So it's like a snowball effect of a problem.
It is, yeah. There's a lot of issues in the market that's causing this problem. So, I mentioned earlier how we're just supply constrained, right? Like we have a huge labor shortages. And there's a few reasons for that. One is that uh, the nursing schools, for example, like cannot train enough people, right? There's wait lists for nursing schools that are of the tens of thousands of applicants that can't get in because the nursing schools don't have capacity to train more because they don't have enough faculty, right? They don't have enough nurses to train the nurses. The second bottleneck that happens is right after nursing school. You may have experienced earlier in your career, Sheena. Like when you're a new graduate nurse, it is hard to find that first job where you can get trained, right?
Sorry.
And there are just simply not enough health facilities out there that are willing to train nurses. And then another big issue that's happening is retirement, right? So about 25% of nurses are, the baby boomer generation, and they are approaching retirement over the next few years. And so we have a huge part of this nursing workforce that's about to retire as well in the next 3 to 5 years. And so this combination of issues is some of the reasons why we have such a big shortage.
Yeah, I know when I went to your website, I almost like dropped a little tear. When I went to your website and I saw at the bottom how, you have the option for nurses. Well, that is your basic algorithm. One of them is for nurses to say what they want and hospitals to basically audition for them. And that I'm telling you, the tears just came when it was right here because, I think that so many times as practitioners, we don't always realize our power, and we don't always realize that like we are the prize as well. The hospitals are a great prize too, and we want to work for them and have benefits and have everything that they offer. But we also want to feel like we're a prize too. We're the ones putting the work in, and we're the ones who ultimately affect how much money you make, because the patients, their satisfaction scores are mostly based on us. The doctors of course play a huge role, but the person that's with them all night and all day is typically the nurses. So it's a huge thing for nurses to be happy. And I think that by having a situation where the hospitals audition for the nurses, it benefits the hospitals too, because then they can see what nurses do want. Okay, we haven't had as many hirings as the hospital around the corner. Why? These are some things that maybe we can work on. And I always say that we almost need someone like almost like a liaison between the two sometimes, to tell hospitals what nurses and doctors and CNAs need, respiratory therapists, everyone, and also to tell the nurses and the practitioners what the hospitals need. And that's not always relayed. So to see that on your website just made me feel like, wow, like maybe we can like completely change healthcare by making sure that we make everyone feel as valued and as important as they actually are in the system. And it's just so cool. I'm amazed.
You're exactly right.
Sorry to interrupt. I think anytime big corporations, whether they be in tech or the healthcare industry, anytime you empower your employees, you have a more efficient workspace because everybody's feels good and wants to do a better job. And I think empowering employees is always a really effective tool in making your business profitable and run well. Of course, there are many elements, but with this business, you are really empowering nurses and making them realize their power and making them realize that they do have a choice where they go. And when people are empowered, I always think they want to do a better job and they feel better. And when nurses and healthcare professionals feel better, feel respected, feel heard, feel like they have a seat at the table and a voice, they're going to want to do their job better. You're going to have a happier place. And then it's going to make it easier for everybody because you want your fellow nurses to be happy, Sheena, right? You don't want them tired or salty or mad or it's just it's such a useful tool. um I hope you feel really proud of yourself because
Thank you.
I'm so proud. I'm so proud. Like, I don't know if you can see it, but I'm like so excited.
all of these healthcare, I think this is our fifth discussion now, and we try to you know talk about different topics that are they're going to speak to a wide array of issues within the healthcare industry. But this is something so unique and something I came upon. I didn't even expect. I read about you in an
That's
article
right.
about this business, and we hadn't even thought of this. And so I hope you're giving yourself a huge pat on the back for bringing tech in and really providing a very solid solution to making people feel heard and not seen, making people feel seen.
Yeah, thank you. I appreciate that. Like the mission of our company is to help healthcare professionals live better lives and to help them find and do their best work. And I just, being an MD, Sheena, you're an RN. Ellen, you played an MD as well on TV. Healthcare workers are overworked and they're underappreciated. We see it in fictional TV shows, and we even see it in real life in 2020, especially in terms of how overworked they get and how underappreciated they are. And so we do want to be the one service, the one product, the one app out there that's just giving them just a very delightful experience. Because Sheena, as you said, they should be highly valued.
Yeah, and I think that that's the part that a lot of, again, people miss is that, like Ellen said, by making your employees feel like they have a stake in the company makes them love the company. And that's, how some companies provide like stocks, shares for
Mhm.
their workers and things like that. That's the same kind of like notion. It gives people pride in what they're doing. And I just want to ask, have you seen a like a high satisfaction type of rating with the nurses that end up in these hospitals? Have you seen like a positive, like have they had a positive review on it?
Yeah, we have lots of reviews on Facebook and Google for the incredible health service from nurses, and they absolutely love it because the what we call the candidate experience is like very positive. One of the interesting effects that we've had that was honestly a little bit surprising for me is that when nurses are hired through our platform, their retention or like their staying at the hospital for a longer period of time actually goes up. And many hospitals and health systems do struggle with turnover, and they struggle with the retention. They struggle to keep their workforces on their team and also keeping them happy. And we think the reason for that is like when a nurse is using the incredible health service, he or she is able to consider multiple opportunities and go through and choose through several interviews before actually explicitly choosing a specific employer. So it's a very informed job search process that they are using.
Iman, can you speak a little bit about um, do you have a lot of experience with nurses wanting to maybe change their specialty
Yeah.
or and sort of more broadly, Sheena and I have a lot of conversations. We're good friends and we talk all the time about a lot of different things. And one of the things we talk about is racism in the different fields of nursing, right? Like it, is there any sort of way, could you talk a little bit about that? And do you offer any sort of services or do you have uh, anything
Tools.
to add to how do we get nurses of color to feel like they can apply for nursing jobs that aren't typically seen as fields that Black nurses are going to be able to get into? Sheena, um, clarify it for me. Is it labor and delivery you feel like you
Yeah, and it's in Philly for sure. I've worked at 5 hospitals in Philadelphia. And for the most part, most of the RNs of color are typically on the med surg units, the rehab units, the units, and they're units that I've worked on and I have no problem with, but they are 100% the units that people feel like are overworked with less resources and less staff and equipment.
Mhm.
And those floors have more units, have more nurses and staff of color. When you go to the ICUs and the L&D, you may see one or two. When you go to the specialty units, you may see one or two. And those units are not paid more. Of course, in the same hospital system, once you go outside of the hospital system, you never know, but those nurses are not paid necessarily more, but they have a different work experience as far as staffing and resources and equipment. And it's something that we all kind of see, but don't realize the correlation, especially because I'm a floater. So I go to every unit in the hospital, so I can see it. Whereas someone else who works on one unit, they may not see the ratio of how many Black nurses versus white or Asian or Latino nurses. So, it is something that I was going to ask you is, do you see a difference in people of color and their experience as far as applying, as far as like what jobs are available to them? Because even in my experience starting out, I just knew I was going to be a midwife. I planned to be an L&D nurse for a couple of years and then applied to be a midwife. And I've applied to over 5 hospitals for L&D and never was taken. But every single time I applied for a med surg unit, telemetry unit, I was available, ready. I've been a nurse for 9 years. I have my BSN. I have the qualifications and just was never in. So now I'm over it. Now we're heading to retirement. but I just wanted to ask you like your experience with that and how nurses say they feel about it.
Yeah, I think, look,
how do we make change?
Yeah, this is a really important topic. I mean, Sheena, you highlight, and Ellen, you highlight very specific examples. It gets even worse when you look at nurse leaders too. The supervisors, the managers, the CNOs, so on. And the reason the topic of diversity in healthcare workers is so critical is because all the data and research shows that when patients are working with a diverse workforce, their outcomes are better, right? So, and a lot of that has to do with like patients want healthcare workers that match them, right? Like, and you are more, there's so much data that shows that if you're a Black patient and you're interacting with a Black doctor or Black nurse, you are more likely to listen and actually follow the recommendations and that healthcare worker is giving. And then as a result, you have better outcomes. And so there's just a strong desire, just simply from patients and just like the American consumer, basically, of healthcare, to work with healthcare workers that look like them. Now, this is a topic that I think, especially after George Floyd, like every C-suite healthcare hospital executive is aware of now, and putting in implementing solutions to address. So specifically for Incredible Health, there's a few ways that we've addressed this. Number one is that when we are presenting the applicants inside the Incredible Health application in front of the employers, we random sort, right? So every nurse has equal opportunity, basically. The other thing we do is like nurses can use avatars for their profile pictures instead of their own profile pictures, and so that really kind of like hides any data around demographics or race. That also has helped us reduce the bias on the platform too. Another thing, I'll mention on the topic of software and databases and algorithms and bias, like it's a critical issue that like comes up a lot with software and with algorithms, because you want to make sure your software isn't introducing new bias. So I'll cite like one example. One of the things that we do is we try to counter any kind of human bias. So for example, we noticed early on that employers were biasing against nurses that lived further away, right? So if the location of the nurse in their nurse profile was further away, even though that they said they wanted to work in, say, Philadelphia, right? They would get fewer interview requests. So we were like, okay, so what would happen if we just remove the current location of the nurse? And when we did that, the human bias just went away, right? So there's like a huge amount of opportunity when you're building a software platform that has things like algorithms and so on, and we're tracking everything too, to implement solutions like this that will counter any kind of human bias.
My God, Iman, you're just making me
Yeah,
want to cry.
but
This is
there's a
just
lot.
beautiful.
Yeah, there's
This
a
is
lot more work to
beautiful.
do in this area. I mean,
No, but just the
yeah,
thought process of, I just don't think that people realize healthcare is not in a unit that deals with information, connects the dots and then changes.
yep,
Healthcare stays the same forever. Like
yeah,
it's not something like they change and tweak little things, but it
hmm,
really takes a long time for healthcare to improve itself, especially when it's talking about the workers and not the patients or money, you
yeah,
know? So
yep,
it is largely just like so inspiring that you take the time to say, okay, let me notice this bias, even though it's something as simple as where a nurse is located. That's huge. That's
yep,
huge when it comes to, when you're looking, because the nurse that's further away may be in a poorer population.
yep,
So you're minimizing what jobs they can get in a maybe more not so poor population. So it's beautiful. And I just want, anybody who's listening, who's hearing this, to understand that, you know, when I walk into my patient's room as a Black nurse, they light up.
yeah,
When I have a patient that is Black, I've heard patients say to me directly, now I know I'm going to be okay, or now I know that someone's watching for me. And before we get like, oh, clutches pearls, are we saying that a white nurse can't take care of them? No,
no,
they take care of us great. We have plenty of opportunities to have great health care from all types of races, right? But it is proven, like Dr. Iman said, that when there is a more diverse unit and diverse practitioners, that people of color have a more positive outcome. Is proven even with babies. Babies have a 50% less mortality rate when they're taken care of from doctors that look like them. And it all comes down to people, and even the bigger picture of the only type of racial, I guess, education that we get in healthcare is like little PowerPoint presentations that we have to sign off and say that we looked at.
yeah,
And that's not going to help. That's number one. Number two, systemic racism in healthcare is a clinical emergency. It's a
yep,
huge deal and something that's killing a lot of people, but we don't direct our attention to it the way we would if we found out that, I don't know, honey makes you get cancer. Like, you know what I mean? Like we're not directing our attention to it as if it was something that is that. So the biggest way to combat systemic racism in healthcare is to have people of color in the room. If we're in the room, then we can adjust the room, because now I can pull my other coworkers aside and we can learn from each other culturally. I can learn what works for your patients, what works for patients that look like me. We can all work together to figure out what's working best for everyone. But when we don't have people that are in the room, you just keep moving how you've been moving, and everyone says, I'm not racist, that can't be me. Right, but Black women are 3 times more likely to die in childbirth than white women. So it doesn't matter if it's not you personally. We all are ticking away at this little bits and not realizing it. So by having more people in the room, that solves half the battle. So I would encourage anyone, if you're listening and you want some type of career in nursing, to 100% look this up, because this is beautiful. And I just want to know, what do y'all have cooking for the future? What do you have? What are some things that you want to develop for the future?
And before she answers that, I just want to say, to your point of what you just said, I personally want to say I'm sorry, Sheena, to you that you feel like you have to say that doesn't mean a white nurse can't take care of a Black person. That I'm not, you're apologizing for racism and you're apologizing for bias. And if you're a white healthcare professional watching this and you're taking from what Sheena said, you're somehow understanding from what she said that she's saying what she just apologized for is that she meant that a white person can't take care of a Black person without bias. That isn't what she said. And if that's what you hear when she says that, then you need to self reflect and ask yourself why you got defensive when she says that. And she knows you're going to get defensive. And that's why she felt the need to apologize for what she said. And the truth is, she shouldn't have to apologize for what she said.
Yeah.
She should be able to state the reality without you feeling any type of way about it, because it is a reality.
Absolutely.
Sorry.
Absolutely. No, I mean, you're 100% correct.
My white friends and white healthcare workers out there who, this is why we're doing this. This is why we're having these conversations. Because if you hear certain things and it draws feelings, we need to examine those feelings. And we need to not be emotional about it. We need to just self reflect and ask, why did that make us defensive? Why is her saying those things make me feel that way? And so that's precisely part of why these discussions are important. So we want to invite that kind of self-reflection and rewatch it and a second and third time and see if you feel differently, and you can make yourself feel differently listening to Sheena speak her truth, and and just analyze why you feel what you feel if you feel things.
Yeah.
So sorry to interrupt, but that's what I just had to put that in there.
No,
Thank
I
you,
mean,
Elle. No, it's important to say, because
100%.
I think that we have to remember that patients are at their most vulnerable time when they're in front of us. I'm meeting someone on what may be the worst day of their life. So I don't get to question why they're uncomfortable with what I got going on. Like, you know what I mean? Like, that's their most vulnerable day, whether they're giving birth or in an ICU. Those are the two top places where we're not as represented, but those are the two top places that you're the most vulnerable. So when a patient feels more safe with someone who looks like them, this is through systemic racism and something that has been proven over hundreds of years. It's not now, it's not today, it's yesterday, the day before that, and it's proven. We can name countless situations and statistics that prove these things. So it's just a moment for us all to take reflection of what we hear and why it makes us feel anyway. Even for those patients of color that say that they feel safer with someone who looks like them, we can also analyze that. Why do they feel that way? So Iman, go ahead. We just
Yeah.
want to know what you have in the future and what you have going and how this is working for everyone.
Yeah, I mean, one more point I just want to say on the topic before we move on to the next one is just, the academic research proves what Sheena's just talking about, right? So when you look at minority patients of any type, Black, Hispanic, whatever, and you correct, and even if you control for income, for health insurance status, for location, even if you control for all of that, they still have worse outcomes than white patients. And that's across every disease area, cancer, labor, like everything. And so, yeah, one way to counter that is to just have a diverse workforce, right? So yeah, in terms of just what we have in the future. So look, our mission is to help healthcare professionals live better lives. In the early days of the company, we were really the place where a nurse finds his or her job. And what we've expanded to is becoming the place where a nurse manages his or her career. And what that means is we've added a lot of free services and tools to nurses that any nurse in the country can use. So for example, we offer free continuing education to every single nurse in the country. Continuing education is something that's needed to renew and activate their licenses. And it's usually something that nurses have to pay for out of pocket. And I think over $250 million is spent by nurses every year in the US on continuing education. And we're like, this is crazy. This is online content that is accredited in all 50 states that we can provide for free. And so we added that to the platform, and that's seen, large uptick and pickup from nurses. Another is like we provide free salary estimators to nurses in the country. So 80% of nurses are not fully informed about what they should be getting paid, especially in different cities, and they're collecting information on salary from their friends and so on, and it just shouldn't Google or wherever, and it just shouldn't be that way. And so we've collected a huge amount of salary data from our platform and are able to provide these salary estimators for free to every single nurse in the country. More recently, we launched an exclusive social network that's just for nurses. Nurses have often commented, and Sheena, I know you're active on Instagram and so on, but like nurses don't feel that safe on social media. And it was important for us to create a social network for them that's exclusive for them, where they can post anonymously, and that's exclusively for nurses. And that exists inside the Incredible Health iOS and Android apps. And this is a place where nurses are able to support each other. They give each other advice. The topics range from like, how do I change specialties, to like fun things like, what's the best, I don't know, scrub brand I should use, right? And or like, what are your thoughts on the vaccine, and so on. It's just a safer place to interact. And in nurses, we mentioned that how overworked they are. They have gone through a serious amount of stress, I guess, especially in the last 12 months. And sometimes one of the key ways to alleviate that is to interact with their peers.
And something that I hear often whenever I mention ways that any situation, institution can improve, the nurses almost defend the institution. Like
Yep.
we're so programmed to think that this is what we should be getting and this is the top, that nurses almost are like, well, this is nursing. Oh, it's better than other places. Or, you get what you get. Well, this is all that we got. And it's sad. It's sad. If people only knew what my job entails, it entails every job in that hospital,
Yeah.
like we do a lot. We do a whole lot, and we do it with a smile because we know that our patient, they don't have anything to do with what our workload is. So when I walk into my COVID patient rooms, I know that I'm the only person he's going to see for the entire day. I can't put that load on him. But when we come outside of the room and we voice those type of concerns, that's when you're hit with, and nurses themselves don't realize that it's not okay to short yourself because you think that this is what is expected. This is what is the top. This is all that you should be getting. You shouldn't get a break. You shouldn't get a break without your phone. You shouldn't get an hour to yourself. You shouldn't be able to leave the unit during your break. You shouldn't be able to take a nap during your uninterrupted break. You shouldn't these are things that are so simple that we just like don't realize are available to us and don't realize that we should be fighting for, we should care about. So just the tone of your website was very much so that like you're valued here too. And we want to show you how you can value yourself by choosing a hospital that works for you. And in turn, there will definitely be a switch from hospitals now knowing that they have to be beneficial to us. And that's 100% what this shortage will do, is make hospitals realize that they got to do a little switcheroo, because now, as you know, these traveling nurses are making bank, and I'm here for it. Shout out to all the travel nurses out there.
Yeah.
So, hospitals are learning that like we have to do more. Have you felt that? Have you felt that hospitals feel like they have to measure up a little bit more?
They do. I mean, the hospital executives, in addition to prioritizing patient care, like they do have to prioritize their workforce. Like they are operating in a very competitive market. They're competing intensely for talent. The other thing about hospitals is that hospitals run on very thin margins. So when you do have a lot of travel nurses, of course, shout out to them, and I'm glad that they're getting paid, right? But it's those additional costs that the hospital's incurring is highly problematic. And every executive we talk to is under a lot of pressure to reduce travel nurse costs and reduce premium labor because it's impacting their bottom line. And so what better way to do that than to hire permanent nurses faster and treat them better, right? So they don't leave. And that's why intentionally, actually, we only focus on permanent workers, because that's honestly what the executives want. And even for a nurse, I mean, probably nurses spend maybe 2 or 3 years of their career as a travel nurse. The rest of the time they are permanent workers. They do want to be dedicated to a specific employer and a specific unit and a specific team. And so we do focus a lot, exclusively on permanent nurses.
And if you think about it, hospitals spend so much money on precepting new nurses, all for the retention to be low, and or paying more money for travel nurses, all for them to leave in 3 months. And it makes total sense that they would just hone in on trying to keep the nurses that they have. So it's going to take resources, because it's like when they do lose nurses, nobody ever comes to the nurses and asks them, hey, why are you leaving? Nobody ever goes to the obvious source and says, why do you think that nurses are leaving? What do you think that we should do to make nurses stay or make them happier here? So I think that, like I said, your website puts the power, shifts the power, not that it's like a power thing, but it is almost like a give and take as far as like how can we make both parties happy, keep the budget right,
Yep.
but also keep nurses in the position that they are in. So I think that's like a beautiful way to do that. And I'm, I'm really, really excited for how, where you will
Yeah.
get going. I seen a lot of, are you mostly in I seen a lot of states there when I saw the list, but is there anywhere where you're more populated or less that you want to get into?
Yeah, so over the next year or so, we do plan to continue adding more free services and tools to nurses because they love them, and so we just want to keep building that for them. The other thing we're doing is like you mentioned, our geographic expansion. So we operate in 8 states right now. We'll be in 13 states by the end of March, and we'll be in 30 states, so more than half the country by the end of the year. And yeah, we started in. I'm headquartered in San Francisco. We are headquartered in San Francisco. That's where I'm dialing in from. And we started in our home state of California and expanded to Texas, Florida, and now we have rapid expansion throughout the South, throughout the Northeast, and in the Midwest as well. And we're just excited to bring this product, this service, and all of them, whether it's the hiring product or all the rest, to the rest of the country.
Wow. Yeah, I'm all in for this. Ellen, where'd you find her? Where'd you
I read about you did a video with another entrepreneur,
Yeah.
and they highlighted it on the broadsheet.
Right. I think it was Toyin, doctor who's co-founder of City Block Health. Yeah.
Yes, City Walk Health. Yes,
Yeah.
and we're hoping to do a Zoom with her as well. I
Great.
think.
That's fantastic.
The scheduling of all of you is quite challenging because you're all so busy. But Sheena, those last comments you were making, the first part of it, when you said women, well, maybe it's unfair to say women, but or not. Women don't challenge the institution, right? Why don't we challenge the institution? I'm sorry, but I cannot help but that's like a critical psychological ailment that we see so many women have right now.
Yeah.
I mean, what is that? Why are women okay with the patriarchy? Why are they okay with these Republicans dictating what they'll do with their bodies? And that is, it's the oddest personality trait to me is women who defend these patriarchal institutions that have been meant to oppress and meant to keep people quiet. It's really something that we see across the board for everything, right? And because most of the major institutions, whether it's banking, whether it's healthcare, whether it's the financial sector, the tech sector, there's patriarchy that exists everywhere. And then we have this whole element of, I mean, we could reduce it down to the most sort of simplest terms and call them Karens, I suppose. They're
Yeah.
just so hell bent on defending these racist patriarchal institutions that have been in place forever, that don't want them to have any power at all, and yet they're on the front lines fighting for it.
Yeah.
doing all the work?
All the work and catching all the heat, and will get nothing from it, will not benefit in any way from any of it. So
So I think in healthcare that's starting to change, right? We're really seeing some improvements in this area, thankfully, finally, right?
Especially California.
Especially in California. But also in
my sister Maureen Pompeo has a company called Gallo Glass Consulting, and she works in administrative healthcare space.
Yep.
And she said in Massachusetts they are making amazing strides in the hospitals, in Mass Gen and all of the hospitals there, which Boston's obviously another big hospital city.
Yeah, so we work with over 300 hospitals and health systems across the country. So we work with big health systems like HCA Healthcare and Baylor Scott and White and Kaiser Permanente. We work with many academic medical centers too, like Cedars-Sinai and Stanford, and lots of community hospitals too. And so there has been a really big shift and change over the last, gosh, probably 12 to 18 months, where and some of this is driven by business, right? Because a lot of these issues that we're talking about is actually impacting the bottom line now, right? And so there have been a lot of initiatives that they're implementing around um, being more explicit about career advancement opportunities for nurses, right? And having a, when on day 120, since from the start date of the nurse, like making sure that there's actual career plan that's documented for the nurse, and doing exit interviews if nurses do leave, so they can get that information for why they're leaving. They are adding, a lot of work is being done on internal equity when it comes to pay, as well as benchmarking against a compensation outside the facility too, because comp is a whole topic that has to be dealt with fairly in order to attract the best talent. And so there are a lot of initiatives in place, because now it's a business imperative to make sure to retain your nurses. It's a business imperative to keep the workforce diverse. So we are starting to see a lot of these changes.
Yeah, and I think it's about making people feel comfortable to speak, because it definitely, in a lot of institutions that I've worked at, it almost makes you feel like if you speak up, then you're the difficult one or the complainer, or when like you're literally asking for the basics. Like, I'm just asking for a vacation. Like, like I'm just asking for a break where if I am tired, I can close my eyes and not, feel like I'm going to get fired for it, even though I'm titrating drips that can kill people and I probably should take a nap on my break. You know what I mean? So, when it comes down to it, I think it's just giving them a voice. And this is a huge step to give someone a voice and understand that it's a balancing act.
Absolutely. And there's a generational thing going on too, right? So
Absolutely.
the millennials, Gen Z, when you read the surveys and reports about those two generations across all industries, not just healthcare, they are making employment decisions based on things like how diverse is the workforce, or based on how flexible is the employer going to be with me. And so there's millennials and Gen Z is asking for more, and they're getting it, and especially in areas where we have huge shortages, healthcare being one of them. Tech is another industry where we have massive shortages. We don't have enough software engineers and so on, right? And so you can see these employees, they are slowly and gradually they have the upper hand. And so what matters for us is that we want to make sure that we remain healthcare worker centric, and we always prioritize their needs, because that's ultimately what it's going to take to win in this market.
Absolutely. And another question I have for you is, when a company, when a hospital, institution, healthcare facility, when they decide to take on Incredible Health, is it something where they have to be exclusive to just your company, or can they still, how does that work?
Yeah, they can still use other, they use job boards, for example. They use their own hospital's job board. There's a few reasons why they use Incredible Health. One is the speed to hire. They are under a lot of pressure to hire faster, because when roles go unfilled, that's more overtime, that's more burnout, that's more travel nurse costs. And so they do need to hire faster, and we're guaranteeing less than 20 days to fill roles. The second reason they're doing it is for cost savings. So we save them, to at least $2 million per hospital on travel nurse costs, on overtime costs. And then the third reason is honestly, like the platform is candidate centric, and they've all recognized, and they've all figured it out now, that they need to be as nurse centric and candidate centric as possible in order to win in their market.
Wow. Yeah, I just was wondering that, because I know that there's so many places that people pick up nurses from all over.
Yeah.
But I think that this is like a great addition to be able to add. And I think that, one, having the position filled faster will help everyone. And I think that when there is someone that's thrown into a role, they're not always sometimes travel nurses are surprised by what they find when they get there, and you only are there for 3 to 6 months. So it's kind of hard to develop relationships. And a lot of travel nurses end up staying where they are anyway. So I think it's really cool to have, I think if this was more of an option, then there would maybe be less people that are, one, unemployed, two, thinking about retirement because they don't like the facility that they're in, but don't feel like going through the process of applying and, whatever. I feel like having that type of power over where I go would make me 100% feel like, if this location isn't serving me, I'll just go on Incredible Health and find what does, And that's a huge, Ellen, you're smiling, but but no, seriously, because there's so many times where you hear nurses say, I need my job. They can see something that they know is completely wrong or completely not serving them or selfish or not something that makes them feel valued, but they'll just, whatever, I need my job. So this is like a whole nother way to open the door to, yeah, I need my job, but I also am one of the top jobs in the country and I can get another one on Incredible
Yeah,
Health.
that's right.
To have, with everything that people juggle, right? If you're having problems at your job, it's like, okay, I'm having problems at my job, but the daunting task of how I go about finding another job, plus homeschooling my kid and dealing with my relationship and dealing with my older parents, or
Yep.
everybody is juggling a myriad of things, and the task of having to look for another job, even if you want to, is like, you have to say, do I have the bandwidth for that?
Yeah.
And I think Incredible Health gives you a tool to be able to have the bandwidth to deal with that, because you really essentially do most of the work for them.
Exactly. Yeah.
Process um, so much less painful, and just free up your time so that you can devote time to everything else in your life that you have to. And kind of Incredible Health is the safety net that's going to help you find a job, and you're also an incredible safety net for these healthcare institutions, for these hospitals. um I mean, brilliant service, Iman.
Thank you. Thank you. Appreciate it.
Service to hospitals and to nurses is a win-win for everybody. So I'm really happy to meet you today, and hear all about
Yes.
this incredible
Yeah.
And
health.
I'm super excited for your expansion. I can see this being, I mean, I don't even know how to quantify it, but I can see this as being something that can 100% be nationwide and be huge for our industry. And I'm so proud that it's you, sis.
Yeah, thank you. No, I
So,
appreciate that. Our goal, we are defining a new category. This is very different from what's already out there in terms of job boards and recruiting agencies and so on. And the whole nurse-centric approach is also unique to us. And we're just really excited to turn into the market leader, and we do, like, this is really about democratizing job opportunities across the board, right? And what both of you said is exactly right. When nurses are looking for a job, or doing anything that's career related, to be honest, whether it's their continuing education or looking up salaries or whatever it is, they're often already working. In fact, we're working overtime, or working night shifts, right? And a job, searching for a job is one of the most stressful human experiences out there, regardless of what profession you're in. It's probably, I think it's second to dating. And so to just alleviate that and make it a little bit more delightful is what we're very excited about, and just helping healthcare professionals live better lives.
absolutely. Well, I am blown away by this. I'm so happy that Ellen happened to see
Yeah.
your
Yeah,
this
Ellen
in the
found
rush.
us. Ellen found us, not the other way around. It was so cool.
Yeah, I am like, just blown away by this. And it's just really important that I really hope that this video is seen by so many, because if I could shout to the rooftops about this is like a great way to get nurses in the door to places that they really want to work at. And there are plenty of places that nurses feel more appreciated. It's almost like you can have like a review system, like 5 stars to like different healthcare institutions, and nurses can say like, oh yeah, well girl, I worked there and I didn't like it, don't go there. You know what I mean? So
Sheena, you should be a product manager on our team, because that's what's
hire
coming.
me,
That's what's
man,
coming.
hire me. No, but seriously, like I think that's a great idea.
Yeah, it is. It is. And it is in development.
Amazing.
Yeah.
When Sheena and I started to have these conversations, we came upon the name Healing Healthcare very quickly,
Mhm.
because it really was what we wanted to do with these conversations. So thank you for having this business that I could find, and for being a part of these conversations, because this is truly Sheena and I's mission, is to help healthcare workers, to help people who are in the business of helping healthcare workers, to just heal healthcare. And we know it's a monumental task, and we're not going to be able to do everything, but if we can chip away at it a little bit at a time, and help hospitals operate better, and help healthcare workers feel seen and heard and have a better experience, ultimately the patients will have a better experience. And so super grateful to you, Iman. Thank you so much.
Absolutely. Thank you so much. I appreciate you guys hosting me and having this platform.
And is there, so there's an app. Tell everybody one more time before we end the Zoom exactly how to find Incredible Health.
Yeah, so you can find Incredible Health on incrediblehealth.com. And then we also have, for nurses, we also have an iOS and Android app, which you can download in the App Store and the Play Store. But our website may be the easiest place to start. So incrediblehealth.com.
Great.
And I'm following your Instagram. So the
Great.
Instagram is Incredible Health. I know, guys, but there's Instagram is such a huge industry too, as far as like finding things and figuring stuff out. So their Instagram is also Incredible Health if nurses want to reach out. And if you want to, I'm telling you, I am 100% for this company. So for sure, if anyone reaches out to me, I will definitely link you there too, because this is important, and this is important that nurses have power and say so. It's too many times that we're kind of just like winging it and miserable. So, and our patients, they're at their most vulnerable time, and we need to be on point, and we need to feel comfortable where we're working so that we can make other people feel comfortable. They can feel that it's an energy shift. So I'm all the way for this, and I'm so happy to have met you today, and I'm just excited. I'm just happy.
Yeah, thank you so much for having me. I'm really, really glad we were able to chat.
Thank you so much, Iman.
Thanks, Ellen, for finding us in the first place.
Pleasure. We hope to speak to you more in the future. We want to hear how things are going.
Absolutely. There will be lots of product updates and announcements and new expansions and so on.
Yes.
So
thank you so much, Iman.
All right.
Have a great day. Thank you.
Thanks. You
Have
too.
a great shift tonight.
Thank you. All right. Bye.
Bye.